Hey everyone, my name is Jake Nelson. I'm the exercise physiologist here at the Wellness Center. A little background on me: I graduated from Western Illinois University with my degree in exercise science 3 years ago. Since then, I've worked for a chiropractor with a team of nurse practitioners where I specialized in rehabilitation. I worked with a few hundred patients throughout the 2 years that I worked there. I worked in tandem here at the Wellness Center in personal training, and then most recently this past year, I've become an exercise physiologist. Today we're going to talk about ergonomics and the importance of ergonomics and the exercises to prevent workplace issues. When people typically think of workplace ergonomics, they think of strengthening exercises and stretching exercises to prevent injury over time. What that means basically, if you're a welder, a construction worker, you're a lot more likely to injure yourself or your rotator cuff. So you want to do strengthening exercises to prevent that, and stretching exercises to help prevent muscle imbalances that lead to those injuries over time. Those things are pretty easy to measure. What's not so easy to measure is the little things that you do every day that give you low back pain, hip pain, and knee pain caused by inactivity. So a lot of people that work at the desk or sit down the majority of their day, different muscles get tight, different muscles weaken over time, over years and years and years. This leads to chronic pain, which leads to arthritic issues that lead to replacements. So this is a lot harder to measure how important these things are. So I want you guys to do these exercises so you can see for yourself how much better you feel. Along with that, another factor of these exercises, they'll probably burn close to 100 calories per day. That may not seem like much, but if you do that 5 times a week, that's about 2,500 calories per month, which is almost a pound of weight that you would be burning just by doing these 10-minute workouts. A pound per month basically gets rid of any of the weight gain that most older adults face as they get older. So this is a preventative factor to keep you more fit as you age. On the final note of why these are important and to get you guys to do these, when you exercise in the morning, it releases dopamine and norepinephrine. Those are two chemicals in your brain that speed up your day, so your day goes by faster. They also make you a lot more happy. So when you do them in the morning, you're going to go into work with the right mindset. Now, along with these ergonomic videos, we're going to be going through some diaphragmatic breathing, some breathing exercises to help those of you who are stressed at work. These are also very important. I know that I say things that I don't really mean all the time. These breathing exercises are designed to make you pause, stop, think about what you're going to say and how you're going to react to a situation. It calms down your brain. It releases the opposite type of neurotransmitters, which calm you down and allow you to work together with your team in a more meaningful and cohesive way. To start off with these lower body exercises, first we have to relieve all the tension in your lower body. Traditionally, the past 40 years, this has been done through stretching. Nowadays, most people opt for a foam roller or a massage gun. Reason being, stretching doesn't actually make your muscles any longer. Stretching just tells your brain to relax those muscles so they have a little bit range of motion. Foam rolling and massage gunning do the exact same thing, except they have the added benefit of warming the tissue up. That's very important. You don't want to stretch a cold PCP pipe or try and bend it. It's just going to snap. It becomes more brittle. So foam rolling and massage gunning have the added benefit of warming the tissue up. Now, not everybody is going to have a massage gun, so we're going to show you how to do this. Foam rolling can be difficult, so if you can't foam roll, I would invest in a massage gun. It will take me no time at all to convince you that you probably need one in your house anyway, so why not have one at home? So the first thing, we're going to go over how to foam roll the lower body, then we'll go into the strengthening exercises. Those will wake you up. This will get rid of a lot of mobility issues that you have right away, so don't be surprised when little aches and pains start to go away throughout the weeks. So the first exercise is foam rolling the hamstrings. Now you want to place as much pressure as you can on the hamstring. Do it for 30 seconds to a minute and then switch sides. This will take some degree of upper body strength to do, which is why a lot of you will probably opt for using the massage gun. Then you can twist your femur to the right and work the lateral portion of your hamstring, or turn it in and work the inside. Find where it's tight or where it's sensitive and try and rub it out for a few minutes. This will immediately relieve any tension in the hamstrings and improve your range of motion. If you're someone that wears high heels a lot or suffers from plantar fasciitis, this one you will definitely want to keep in your back pocket. We're going to foam roll the calves, which are covered in the same fascia that go all the way to your hamstrings. So after foam rolling your calves and your hamstrings, a lot of the pressure in the bottom of your foot is going to relax, and a lot of that pain is going to go away. Once again, you want to put as much weight as you can, lifting yourself, turning your foot to hit both heads of both muscles. As you can see, mine are a little tight, which is why I'm stumbling over my words. The next exercise is for your adductors. Your adductors are chronically tight, especially if you don't work out. That's the inside portion of your leg. This one might be pretty sensitive at first, so maybe don't put all of your weight on these right away. If you're somebody that exercises a lot and your knees cave in when you squat, these muscles are probably very tight. So doing this at the beginning of your day will really loosen your hip sockets up and allow you to get better range of motion for all of our next exercises. So you want to twist your leg out and dig into your groin. Spin about 30 seconds and then switch sides. Now this is a massage gun tool. When you use a massage gun, you want to turn it at the highest setting that you can tolerate comfortably. It will be a little bit uncomfortable, especially if it's tight. Now, over the course of several weeks, your muscles aren't going to be tight anymore, so you can spend less time doing this. But to go over the same three things we just went over with the foam roller, you turn this on. This one's really loud, so I'm not going to. But you rub here to get your hamstrings, and then take a seat here and here, inside and outside, on your calves, and then dig in to your adductors. After you get done, go ahead and practice the squat. Feel how much better and more loose you feel. This is really going to change your life, and that's my sales pitch for this. This first exercise I'm going to show you is called a butterfly exercise. We have bands for you guys. You'll put this on over your feet, through the loops. For any band exercise that you do that's supposed to be around your knees, you want it right above your knees. This exercise is one of my favorites because it allows the patient or you guys to sit down while you do these exercises, so you don't have to crawl on the floor. You can do this anytime you have a bench or anything to sit on. There's 3 variations that I want you guys to do. Each will hit a different portion of the glutes and the glute minimus. This is very important because by strengthening those glute max and glute minimus muscles and the glute medius, it helps pull your femur back into socket and relieve the tension in your hip flexors. Anytime you strengthen one side of your body, the other side, which in this case would be your hip flexors, shuts down. That means you don't have to sit there and stretch your hip flexors all the time because you're strengthening this. Strength goes a lot longer of a way because now we're strengthening the muscles that help you walk, help you squat, help you stand, help you walk upstairs, and strengthening the motor patterns that are going to help you lift patients up off of the ground. That's why I always go the route of it's better to strengthen muscles than always stretch them out. It has a lot more benefits than just stretching. So first, you're going to lean back, open your hips up, come back forward 20 times. Next, we're going to go to a neutral setting 20 times, and then bend all the way over 20 times. For all our exercises, you'll do 2 sets of 20. I would work one exercise, one exercise, one exercise, and then restart over. The next exercise we have is standing hip abduction. So go ahead, put the band back around your knees. The further away it is from your knees, the harder it will be. So when you guys max out on bands after a few months, you can start to lower this down your leg, and that'll make it a little bit more challenging for you. So grab the wall, point your toe in. You never want your toe to flare out. That works the incorrect motor pattern. You want your toe in, just abducting your hip. 12 repetitions, and then 12 repetitions on the other side. After that, your hips will be warmed up for the final exercise for lower body. The final exercise we're going to talk about is air squats. in chair squats for those of you who aren't confident yet in doing chair squats. So we're gonna break down the proper form to do a squat. We're gonna go slightly more than shoulder width apart for most people. You're going to turn your toes out 10 to 20 degrees. Next up, you're going to grab the floor with your feet. What I mean by that is imagine you have talons and you're taking them into the ground. That flexes your foot. The stronger your feet get, the better your arch is going to get, and the less plantar fasciitis issues you're going to get down the road. That also externally rotates your hips, which opens up your hip socket so you can get further, and keeps your knees in line with your toe. So grab the floor, screw your feet into the ground. Next up, you're going to push your hips back, not just bending your knees. So push your hips back. You will bend over a little bit, come down, and then come back up. Hips back, come back up. The whole time whenever I'm doing a squat, I'm telling myself two things. Keep your hips open and keep your hips back. This places the demand on your glutes and your hamstrings, and you're gonna get a lot stronger over time. If you have knee pain, that's gonna take a lot of the pressure off your knees because now you're using all the correct muscles. For those of you who aren't comfortable with their squats yet, we're going to practice chair squats then. Same rules apply. Get spread out, grab the floor with your feet, externally rotate your hips by screwing your feet into the ground. Sit back as far as you can onto the chair, and then come back up with your butt. Back, come back up. When you do this, you don't want to sit all the way down and sway back. You want to pause with about 60% of your body weight and then drive your glutes back and forth. At the beginning, it might look a lot like this, but over time, you'll master this 60% and then be on your way to air squatting. The first thing you want to release on your upper body before you do your upper body exercises is your pec minor. You can use a tennis ball, lacrosse ball, massage gun, or in this case, we're going to use the foam roller to release this muscle. When your pecs are very tight, from sitting at your desk, driving all the time, doing all those little things over time, it shortens your pec muscle. Now that internally rotates your shoulder, well, now your shoulder is not sitting in the socket correctly, which gives it a lot of opportunity to kind of bump and grind into other things, causing arthritis down the road. So if we want to fix that by releasing this muscle, it brings our shoulders back. Now we can do all of our stretching, strengthening exercises to help keep that posture forever. People always talk about their posture. If you're worried about your posture, it's probably too late. You want to weaken the things that are going to keep your posture in a worse position and strengthen the things that are going to keep it more upright. So to start, you really just want to dig your chest in, find the sore spot, and spend about 30 seconds there. Switch to the other side. So the next exercise for foam rolling is going to be release the lat muscle. Same thing as the pecs. When you're slumped over all the time at work or driving or doing any of these tasks like this, your lat muscle right here connects up here. So you want to release this so it allows you to pull your shoulders back. This one isn't super comfortable, so I definitely opt for the massage gun if you do that. But take down, place as much weight as you can. Now with your hand, you're actually going to turn your hand to find the spot. It's going to be right up in your armpit. You'll know when you hit it. Spend about 30 seconds to a minute there. After you get done, especially with the massage gun, if you can only raise your hand up this high prior to these exercises, it will probably be closer to completely upright after these exercises. If you opt for using the massage gun, put your arm up, do your pec minor. As you're going, you should be able to stretch your arm further and further back. Next up, your lat. This one is a little bit harder to get to, I will admit, but if you guys are working out in partners or your group, you can certainly grab it, drill down, find the soft spot, spend about a minute there on each side. We are going to use these nice bands for our upper body strengthening warm-up exercises. The reason we use these elastic bands and why I prefer these, they work like a rubber band in that they absorb force and redirect force. Your muscles, whenever you do any exercise, their job is to absorb force and then redirect force. So when you train it in a way with a band, they get better at doing those things. That means your rotator cuff gets a lot stronger and your tendons get a lot stronger faster. As far as prehab exercises go, these bands are great. It's a lot easier to do these exercises before you're hurt or before you have rotator cuff surgery than after. So 2 minutes a day today saves you 8 weeks in rehab later. To start off, we're going to do overhand band pull aparts. You can modify the resistance by getting your hands closer or further away. Keep your arms locked out, pull back, hit your chest, come back forward, back. Now when you do this, try not to catch slack, because then you're not really absorbing any of the force. You want to be controlled, squeezing your shoulder blades together, keeping your chest high. After doing all of those other exercises, this should be pretty easy. If you are somebody suffering from a rotator cuff injury right now or post-surgery, you may not be able to do this. So a modification would be hands up into a W, squeeze your back together, and then come back. These isometric exercises do a great job of turning on your upper back muscles. That way it kind of shuts down further all the things that are too tight. And you can do them at your desk or any other time of the day. This is the next exercise, same as what we just did, just underhand. Relax your shoulders, push your shoulders away from your ears, squeeze everything together. This will work a slightly different portion of your back. Your thoracic spine is going to get very strong doing these things. Your posture is going to improve, and your rotator cuff and shoulder health is going to be greatly improved as well. The final exercise that we'll do, band external rotation. Grab here and here, externally rotate your arms, come back slowly, externally rotate your arms, come back slowly. You want to keep your pivot point, which is your elbow, directly pointed down, chest high, and this is a great warm-up for any of your exercises as well. And the last exercise I have for you guys today is the push-up. Now there are 3 different variations that we're going to go over. The push-up is a great exercise because it works your entire chest and it helps stabilize your shoulder through a full range of motion. And it also works that back of your arm that a lot of people try to burn body fat in. This is a great way to just kind of strengthen your whole upper body. Now when you do this, take a big breath, keep your core tight. We're going to start with the wall push-up variation. Get as far away as you can, come down, come back up. Anytime you do any pushing exercise, grab the wall, rotate your arms in, that's locking your shoulders into place, so they'll be about 45 degrees whenever you're doing the pushing exercise. This is the same for push-ups, this is the same as bench press, military press, anything. You want to screw your shoulders into place, lock everything in, and come back. Wall push-ups might be very easy for some of you guys, but a real push-up might be too hard. So next up, you're going to find a bench or a chair that you can rely on. Put your hands here and here, do the same thing, lock your elbows into place. This might feel kind of goofy if you've been doing push-ups like this for a long time, but trust me, it only takes a couple of weeks to get back to normal. Same thing, take a deep breath, keep your core tight, come back, touch your chest, come back up. And you can do all of your sets like this. And then the final modification is just a real push-up. Lock your shoulders into place. And drive up.